My name is Hoyne. I'm a consultant psychiatrist and editor of Global Psychiatry Archives. And today I have the pleasure to present a paper from Twana, Rasul, and Samir about the relationship between burnout and job satisfaction among autism coaches in the Kurdistan region of Iraq. Autism coaches deal and support people with autism, and they do it in different ways. They usually have specific strategies, which is applied behavior analysis or individualized education plan. And the question is now, what influences their job satisfaction? The specific questionnaires, for the burnout, is the Maslach scale, and for burnout, it's another scale from Paliga. And the question now is, are they related? The question is also whether other demographic variables have an influence. So the question is there any relationship between burnout and job satisfactions? Are there significant differences between gender? Are there differences between burnout levels and job satisfaction based on marital status? Is there a significant relationship between the participants' burnout and the numbers of hours worked? And are there differences between job satisfaction and burnout, depending on the job type, depending on whether they are working independently or employed in a center? And then the question is, what are the influences of the type of interventions on the job satisfaction burnout? And so the question can be more or less shown, and the results can be shown in these following tables. This is the first table, which shows the demographic and occupational information. So in total, there are 168 people who joined, different ages, different marital status, most single, and they come from different governorates, Erbil and Sulaymaniyah, and they have different years of experience, different working hours, different salaries, and type of work, whether they're employed in a specific center or working on their own freelance, and these job strategies. Right, first thing is we have differences by gender, and what it is that the job burnout is higher in females. There is a significant relationship between job satisfactions and burnout. So the higher the job satisfaction, the lower the burnout. This usually explains, so the relationship between burnout and job satisfaction explains about 50% of the total variance. So marital status doesn't have any influence on the job satisfaction. That's hypothesis number 3. There is a lower job of satisfaction for people and higher burnout for people who work longer hours, and the working type, let's say where you're working, doesn't have an influence on the burnout, but the job satisfaction seems to be higher in people who are employed. And then the interesting part also is that the burnout level depends on the intervention, and it seems that people who practice both intervention, these have the highest remains of the highest level of burnout. So that it seems to be, if people work with one intervention, they maybe be more able to concentrate and focus on one thing, and people who have both strategies of working with children with autism have a higher burnout. The interesting and the nice part of this paper is that this more or less fits with the journal publications and from other countries, but it's also that this paper gives you nice little recommendations what you should do. And so even though this is not really part of the assessment of the paper, but they give nice recommendations that you should be aware things you do. Review what you're going to be doing. That means proper planning and reflection. Make sure you have good relationship with your colleagues. If you're under stress, do some physical exercise. Try to have a little bit of fun during the breaks. Then engage with other people. Try to improve your communication skills. At the end of the day, look what have you done and reflect again. And do something nice when you go and leave work, when you go home and change your clothes. And that possibly means you have to have a different, different way or feeling, and that you more or less distinguish your outfit between work and home. And if you have good ideas, share them with others. So this is interesting. So let's say there is relationships between burnout and job satisfaction, and some factors like gender, and working hours have an influence. You can't change your gender, but possibly it might make sense to make your working hours not too long, that you can work with that, and maybe it's easier to focus on one type of intervention. If you like this, just subscribe to our channel, and there's also a chance to read this paper in the journal Global Psychiatry Archives on www.globalpsychiatry.co.uk. Thanks for your interest. Goodbye and have a nice evening. Bye-bye.